Welcome to the Houston Hospice Volunteer Responsibilities Review, facilitating information sharing, interaction, and collaboration among volunteers. In this tutorial, we will review what skills are necessary to use in your training and the benefits of volunteering. Then we will take a closer look at several skills and learn how to easily incorporate them on your volunteer visits. By the end of this presentation, volunteers will be able to review topics previously learned, identify volunteer opportunities, understand volunteer responsibilities, understand the benefits of being a volunteer, examples, and be able to describe appropriate courses of action. Volunteer training topic review. Let's review what you've learned so far. The topics we have focused on in the volunteer training are hospice facts, history and philosophy, learning skills, personal death awareness, grief, loss, and bereavement, pain and symptom control. What you as a volunteer have learned so far will benefit the role of a volunteer when they encounter certain situations that deal with family dynamics, spiritual care, cultural diversity, care of the patient, and the role of the volunteer. Types of volunteer services. Volunteering with hospice offers a variety of volunteer opportunities to fit many interests. Examples include direct patient care types of service and non-patient care types of service. For example, direct patient care types of service include sitting with patients in their home to give the patients a family a break, visiting patients in personal care homes or nursing homes, translating, making supportive phone calls and visits to bereaved family members, or running errands. Some other duties include light housekeeping, pet therapy, visiting with the family members, answering desk phones and the nurse call system, linking patient rooms with the nurse's station, and also helping to maintain a clean and pleasant environment. Examples of non-patient care types of services include office and clerical, filing, operating the copy machine, shredding and preparing handout packets, also computer work, any type of data entry, creating forms, or preparing any type of documents. Other services include our special events, the community events such as the International Quilt Festival, church bazaars, and our butterfly luncheon that we're very well known for, and the Spirit Award dinner. Also the Houston Hospice Quilt Project, which is also where all the quilters get together and have an annual quilt as a fundraising project. The benefits of volunteering with hospice are often expressed by what some of our volunteers have previously shared. Some volunteers say that it helps give them a better perspective and a greater appreciation for life. It also makes them more grateful and less susceptible to getting ruffled over life's smaller hassles. It gives them a deep sense of satisfaction for being there for someone during a scary time in their life, and also making a significant contribution to their community, providing a service they hope others maybe would offer them when they were in need. Exactly what are the volunteer requirements that you need to have before you become a volunteer with hospice? One thing that you need to keep in mind is that every year, to be an active volunteer, a TB test is required. TB testing is provided free of charge by hospice. You also may be exempt from a TB test if you are what is called a resource volunteer. So if you do not have patient contact, you may be exempt from a TB test. There's also paperwork involved. Forms for volunteer activity reports are required for every volunteer activity. Please include the date, time, and the hours that you volunteered. Do not put more than one visit on a sheet. Your report may be submitted directly to the volunteer office. It can be faxed, scanned, or into a PDF document, and emailed directly to the volunteer director or coordinator for your convenience. While there are many responsibilities to keep in mind, we will explore just a few as reminders. All of these examples relate to the importance of effective communication. Volunteering is a commitment. You are expected to offer your time at least once a week for volunteer visits. It is important to remember that you should not take an assignment if you cannot follow through with a visit. How much time is involved with a volunteer visit to a family? For example, if a family is told in advance that a volunteer will visit once a week for up to 4 hours, organizers such as a calendar or an electronic device are often helpful for planning your time. Contacting a family member right away is important if after you've been assigned. Making an effort to call and introduce yourself as a hospice volunteer is helpful to let them know that we are there for them. You can remember to make sure that when you call the family right before you leave the house on each day, that you will be making a visit. It will not be necessary for you to make a visit if the patient has died. You can take a book, Kindle, laptop, or any project where you can sit quietly. You may need to entertain yourself for more than several hours. Once you have arrived for your visit, before the family leaves, make sure you ask the following questions. When will they return? How can you contact them? Are there any special instructions such as special needs or information about their medication? Most importantly, you will need to know who to call just in case. When there is a patient emergency, you will call hospice first. Hospice has already made arrangements with the family members and patient. Do not call 911. When do you call 911? If there is a fire, then you call 911. If you have any questions, please call the volunteer department and speak with the volunteer director or volunteer coordinator. We have a volunteer coordinator in the El Campo office. However, the numbers you will be calling are for the Texas Medical Center Hospice. These numbers are 713-677-7120 and 713-677-7128. Let's review best practices. Best practices will include communication and common sense. When all else fails, make sure your communication is very direct and right on with people. And what else should you keep in mind? You use your common sense. As Patsy always says, you are not protected by the hospice angel. If you don't feel safe, don't go there. Let's review in summary. First of all, keep in mind how the volunteer topics we have learned apply to your training. Know how these topics can be applied to the volunteer services available. Next, remember the benefits of being a hospice volunteer and the requirements necessary to fulfill your responsibilities. Finally, know who to call at all times. And remember to keep in mind to use your good communication skills, your common sense for all decision making and problem solving. Thank you for all the work you do. We appreciate you.